Hi guys, welcome to my channel. My name is Andrea. My friends and family call me Andy. Um, I answer to anything, so you can call me whatever you like. I am starting this channel to shine a little light on what hospice is and what it can provide for you and your family if you're in the place where you are making this decision, and also to provide some education on some of the things that are done while you're in hospice. I'm going to do some med education, some education on your team members, what their role is, and what they can do to help you. Also, I'm going to be doing maybe some meet and greets with a few of my former colleagues that might be able to shed a little more light on what they do as a team member. I have a social worker friend that may join me. I have another nurse who is also doing her own social media platform with grief and bereavement, so that'll be a nice resource for my followers. I have a lot of ideas and a lot of things. I also want to make it a safe space for anyone who has questions to feel free to call, or not call, I'm sorry, but leave me a comment and I'm happy to get back to you with the answer. And at some point I'm going to open it up to some live to a live show or a live channel or episode. Excuse me. And a little nervous. This is the first time I've done anything like this, and I never dreamed in a million years that I would be putting myself out here like this. So I appreciate all the support, and thank you for being here. Thank you for checking me out. Today I'm going to talk about palliative care versus hospice care, what the difference is, and some of the things that you may need to know to make the decision if which platform or which service is appropriate for you right now. So palliative care, it's a step prior to hospice care. It is intended for goals of care for people who are not in a place where they're ready to stop seeing their specialist for whatever disease that they're being seen for. They're not ready to stop seeing the specialist. They are not ready to stop with the treatments. They may want to try new, and as medicine changes every day, they may want to try new medicine, new treatments as they come up. And that is what palliative does. They are an extra layer of service that goes to your home. I think that it's a nurse practitioner that goes to the home maybe once a month, once every couple of weeks. Her or his intention is to help add an extra layer of care, to help add some comfort and some assistance with navigating where you're at in the disease process. So there's that, the goals of care for a palliative person. Now, hospice, on the other hand, hospice is intended for folks who are no longer really wanting to go to the hospital or be in the hospital. They're not wanting to pursue curative treatments. Yes, they can continue to use whatever medications that they're on until they're no longer therapeutic, but a lot of times when you're ready for hospice, the medication that you're using might still be somewhat effective and somewhat therapeutic, but it may also be losing its effectiveness. Let's see. I do have some notes to help me kind of keep track of where I'm at and what I want to talk about. So what makes me an expert in hospice? I suppose you probably would like to know why I think I know so much. I'm a registered nurse. I've been nursing since um, I graduated nursing school as a second career in 2014. I graduated in March and I passed my boards in April and started working immediately in a skilled nursing facility. I call it my nursing boot camp because it really was a very, very quick, fast learn. You jumped in and you did what you had to do and you figured it out. And, I did that for, I only made it through 9 months at that place. And I did go on to another skilled nursing facility after that, where both places I was exposed to folks who were on hospice services, and was able to learn a little bit about it at that time. Um, it's a little different when you're with the patient day to day, as it is to be being their hospice nurse. Being their hospice nurse is much more intimate. It's just a closer one-on-one. Um, a lot of times, a hospice nurse is not only there for their patients, but they're also there for family members, and so we treat the whole family. We don't just treat the patient. We're there for everyone who needs assistance in this journey, and it is a journey. Um, so hospice is, let's see. I'm sorry. I'm going to go back to what makes me an expert. So in 2016, I met a young lady by the name of Stephanie. Hi, Stephanie. She really, really took me under her wing and decided that that's what I needed to be doing. And so, the door opened. I followed. I went and interviewed with Tim and Jennifer, and Dr. Wester was, little did I know, my medical director at the place that I was working at, and her and I had formed a relationship, and I did not know that she was also going to be my medical director at my new hospice job. And so that was really special. She definitely let them know that that they would have been doing good to hire me on, and so they did. And that's the beginning of my journey. I started working in hospice in 2016. I did that for about a year and a half, and circumstances led me to need to change roles for a little while. So I did move over to the home health team at the same place for a couple years, and then one thing led to another. About 2 years later, the hospice was calling me back, and so I moved to another company, and it was a little smaller company, but it sure is not a smaller company any longer. Um, I don't say the names of the places that I used to work at, and I don't have any hard feelings, and I certainly hope they don't either. But we just, the journey was ran its course at all places I was at, and everything leads you to where you're supposed to be. So I truly believe that this is where I'm supposed to be now, providing education to families and patients on the the benefits of hospice, and to try to debunk some of those myths that are out there. There's a lot of people out there that have not great things to say about hospice. They think that we're out there to speed things up and pump them full of morphine and let's get the show on the road, and that's just not what our what we're there for. Hospices, they're they're there to provide education and support, and to help to encourage and support the quality time that we have left. Just quality a quality life with your family, your friends. Sometimes when you're doing treatments, there's lots of nasty side effects, and a lot of the medications that you take have nasty side effects, and we're here to support the decisions that you might want to make at the time in your life where you just don't want to take those meds anymore because they just make you too sick. They just don't make you feel well, or they don't allow you to feel like you want to eat as much, and so you are entitled to make all of those decisions, and we're here to empower you and support every decision you make, and to support a quality of life at the end of life. And that is truly what hospice is for. I have never ever just brought someone on and started them on a whole bunch of morphine to get them unconscious. Usually, if someone's not in pain, we don't ever break out those meds until they need them. And there's a lot of different things that those medications are used for. It's not always what we would think. If a person's not in pain, I'm not going to give them pain medication. But however, if they're having troubles with breathing, I might give them some, because there is, now here's where it's a wanted side effect in this case. It's a side effect of respiratory depression, or it does slow down your breathing rate, which in turn helps with shortness of breath. And so that in that case, we might want to use a little bit of morphine. But I'm going to go into all of that at another time. I have plans for future episodes. I do plan on doing a whole other episode on your comfort kit and what it's used for and when to use it. And hopefully it'll be able to, emphasize and remind you of what your hospice nurse and you have already discussed. You can go back to my channel and look at my video. It's not out there yet, but it will be. But it'll be out there to guide you through how to use those meds in your comfort kit. I'm also going to do another episode on who your interdisciplinary team is. Hospice has a whole group of folks that are there to support you as well. There's chaplains, there's social workers, there's CNAs that help with your bathing. There are volunteers. There's some hospice agencies have massage therapists, and they have music therapists, and some have Reiki specialists and other holistic type of non-pharmaceutical therapies that help soothe the soul, help soothe those parts of us that medicine can't really help with. So we'll go into all of that in another episode. Like I said, I do have lots of friends in the business, so I do plan on meeting with several of them and talking to them about what they do and what their role is and how they help the community. And I think it's going to be a good thing. I think, as I said, feel free to comment on my episodes or on my pages to ask whatever questions you may have. Give me tips and ideas on things you'd like to know about, or things that you think that the rest of the community would like to know more about. Back to the decision of, palliative versus hospice, and whether or not, which service you feel like you're more in line with. So as I was saying, hospice is, the goals of care for someone who is on hospice is more geared towards quality of life. And typically a person who's qualifying for hospice is, they're typically, and not always, please don't take this as a hard fast date, but typically a person who's on hospice services is within 6 months of their end of life, and may maybe more, maybe less. It just really depends on the person. There's been several cases where people come on to services and they stop taking all those meds with the nasty side effects, and suddenly they feel so much better, and their life is extended by another 3-4 weeks than it would have been, or even a month or 3 months. You know, things happen like that. Sometimes a person comes on services and it's just a little too late for us to be able to help in that way, and sometimes they do go rather quickly, and it just really depends on when this decision is made by the family, when the doctors and nurses that they have already been seen by start suggesting hospice services. So, you know, the main difference between the two is goals of care and where you are at with your desire to continue with hospitalization and or treatments. You know, we don't ever tell someone that if they're taking, you know, someone with COPD, if they're using an inhaler that is still helping them, no, we wouldn't tell them to quit that medication. We would see if it's in our formulary list. That is one thing that we do have to keep in mind. All hospice agencies do have insurance companies that are managing their formulary lists for their medications. So sometimes you might run into a case where the medication that you are taking is not on a hospice formulary list. And typically on a case-by-case basis, they do weigh the pros and cons of that, and sometimes they'll approve it, and sometimes it'll be an out-of-pocket expense if you want to continue taking it. It just depends on the as I said, the case-by-case basis. So that being said, I am looking so forward to answering any and all questions you guys might have. Please feel free to comment, like, subscribe, refer me to your friends. If you know somebody who is having some questions or at that point in their life where they're needing to make some decisions, please don't hesitate to send them my way. I have some really exciting things coming up. Like I said, I have a friend who's got a grief platform who she wants to come visit with us, and we're going to collaborate and see if we can't put together some good content for you to give some education on processing grief. Grief begins during the hospice journey. It doesn't begin when the patient passes. There is anticipatory grief that starts far before the patient passes, and so you know, we want to make sure that part of you is being addressed as well. So thanks for coming, and I am so looking forward to helping you all. You may not see my face every time, because when I do some education on medications, I will probably be just showing you maybe some slides, maybe some handwritten things. We'll see. I'm just gonna wing it, and let me know what you want to see. What if you have questions? If you think of things that you'd like me to address. Yeah. Thank you. Have a good night.